big company, but also through oncoclinics, we already operate, absolutely, we already operate 5 oncology centers across the southeast and the north. So we are in Enugu, Ebonyi, Benin, Katsina, and Sokoto, and also we will soon be in the southwest at UCH in Ibadan. So, and we also have 4 dialysis centers also across the nation, and a cath lab in Enugu, diagnostic center in Enugu. So all of these centers are single specialty centers that will be feeding into the hospital as the hub for excellence for surgery, especially like renal transplants, for example, could be set up here and connecting with the rest of the network. So in Abuja, he also collaborates with a number of hospitals around. So he's been collaborating with us on the cath lab in Enugu. And so this is something, a partnership that was already in place, where once the cath lab is ready, he can support us on that. But also we will be establishing, and we are working on establishing other partnerships as we ramp up the volumes.
So what kind of volumes are you dealing with in Enugu, the cath lab?
So in Enugu, we do about probably on average 10 to 15 procedures a month. That's when the cath lab is operating, 10 to 15 procedures a month, which range between from stent placements
to diagnostic
because I anticipate that the volume here will be much larger than
Sure. And our market is 22 million, not only Port Harcourt. So you will see our business model position all over the state, and you will see Peter Odili Hospital as a cherry on all your vision and you want to offer for the society and the community.
And the key here in Port Harcourt, the volumes will be high because also there is a significant corporate network that we can also yes. Yeah, absolutely. And so if we go through the roadmap very briefly, we took over in September 25. We've been basically getting the facility and the equipment ready since then. We'll talk about that in a second. The launch is now. Oncology is launching, but fully will be by early February. MRI by the end of March, when the magnet will arrive, and inpatient we expect it to be, we're saying June, we're saying May, because this is the outer limit of May, June, but we hope that it will be sooner, within May.
So what are the hindrances to the early start for inpatient?
So to have a functional inpatient service, we need to create a matching emergency unit. So I think for us that is a bit of a problem for now. So we're trying to get the needed staffing for that department. And again, we need to test fully the existing SOPs at the clinic level. Once we're sure that everyone gets a grip of it, then we can
like what we were discussing.
Yeah, exactly, waiting times and things like that. So once we're sure that everybody is on board, then we can move to the next phase, which will be inpatient, because inpatient is 24-hour service. As again, outpatient, that is just work within a couple of hours. So we want to be sure that every process is right, and from our timeline, we feel we may be able to get there by May. Hopefully, we should be able to, get there before then.
Sure.
So May is like a confidence point for
Yes,
you.
exactly.
Okay, then for radio, for the diagnostics, who do you have? So is it collaborations or partnerships for the signing of radiologists
Yes.
What system do you have in place for that? Because everything is HIS. Yeah?
Yes.
We have HIS, we have a PACS, that we have several radiologists specialized in different
partnership.
diagnoses and based on partnership. And we're gonna recruit one who will be based here to manage the department, but in parallel, we have a specified radiologist for each, for MRI, for female breast imaging, or
So radiologists or radiographers?
Radiologists.
But we have
Radiologists.
radiographers and
Yes.
radiographers. are
You already have the
Yes.
radiographers.
yes,
so
already we have 5.
Okay. So the Tribune, what does it do with?
Because, you know, for example, in oncology, we have the team, we have the leadership, we also have the network across. So we can recruit now, and while waiting for the machine to arrive, we can train in other centers. and
Has
they will be,
expertise.
ready immediately. That's a, you know, it's a unique point that we have that we can do. In terms of overall quality, we also have the team either in-house or arriving very shortly. So,
I think you've effectively answered that question. My next question is about training. So knowledge transfer and building capacity within the region, and so not just setting this facility as a high quality service delivery hub, but also a training.
Ecosystem.
Yes.
A full ecosystem we are working on.
So what's the plan for that? How?
At the operational level, we have created at clinical level and nursing level, we are thinking a chief quality from expert who will be responsible on developing,
Francis.
yes, on developing all the nursing training. Okay. At the clinical level, we should have clinical doctors coming, visiting doctors who will work with the national team for advanced surgery. It will be a team always in progress, sharing information through teleradiology, telemedicine, and in place. So it's gonna be like a hub for innovation at clinical level and at operational level.
Because what we're thinking from the ministerial oversight perspective is that we would like for personnel from within the state health system to also be passing through.
We actually had that conversation with Zahi. I mean, what I have in mind, especially for the oncology division, is to make that unit more or less the de facto department of the state teaching hospital. So it would manage, it would be more or less, the oncology unit would be more or less a department of the state university teaching hospital. So we would have collaborative meetings, MDTs, case managements together. We would have their consultants here. We would go there, visit. So as much as possible, allow everyone know that not just that the service is available, but we are ready to share knowledge. Then, of course, we will be speaking with a lot of colleagues, especially those in the diaspora, when they are in the country. They can offer us not just service, but also be part of such meetings and trainings that we hope to have with the state teaching hospital.
but it's also, I mean, this is a very important point when we, of course, with your support, we want this hospital to sit within the network of public hospitals in the state. And this is very important, both from a referral pathways perspective, but also support and training of personnel. So far we have 76 staff, but soon to be
80 to 85.
85. About a little less than half, but maybe close to 40-45% from River State, and we're working, actively on that percentage to keep it very balanced, and also to ensure that that the state is well And about 2/3 are important staff for us.
You didn't need to
It's
show us the
important.
slide, it's evident.
Exactly. You made that comment when you came in, about the picture. And just to mention very also briefly about, you've met the team, especially Tony and Dr. Okoro. They have been involved, Dr. Okoro with Evercare from the very start, Tony with hospitals in Ivory Coast, including Group Farah. These are leading hospitals in Ivory Coast that started, and he started for them new facilities. It's a unique expertise that we have here, but also, Francis Baron, who is joining us by the end of March.
From the Philippines.
Actually, he works in
GCC.
Bahrain and Saudi Arabia, so 25 years in the GCC with quality experience across all different departments. Very important for capacity building. This is just to give you the next slide, to give you a very brief idea of all the readiness. And as we discussed, we're closing the last gaps, but we are like MRI, for example, stuff like that. But we are largely we are fully ready for operations. Now, when we look at the different parts, as we discussed, everything has been dealt with. We will require to upgrade infrastructure for medical evacuation. So we have a helipad that has been built. It is not connected to the hospital, so basically
Yeah,
we need
because I was going
build-
to ask, it should be connected to, say, a
Ambulance,
separate
so that the
emergency.
ambulance will go and bring them.
Yeah.
So this is something that we will need to do to basically ensure that that the infrastructure for medical evacuation is fully in place. And we hope that now that you have raised the hospital with your presence, now we can push our the visibility of the hospital and start attracting the patient flow and execute the plan that we discussed.
That's your responsibility, press secretary. You have work to do there. So, what's the capacity of the oxygen plant?
Of the oxygen, the capacity of the
Oxygen plant, yeah.
Oxygen.
Yeah.
We have 20 cylinders for assuring all oxygen pipe for all the hospitals, and we have a plant that will create oxygen even too. So we have
So,
two
what's the
backup.
daily oxygen production capacity?
Approximately we set for 20 beds, so maybe for 10 to 15 liters.
1,000.
But we assure two backup.
Okay. Okay.
And so thank you for reminding me at this point. So we've been also waiting for a visit to discuss with you our plans for World Cancer Day. So the date has not been fully set, but maybe Dr. Okoro can talk us about the
Discuss.
plans.
So, February the 4th is usually celebrated as World Cancer Day, but you cannot the entire February is used for that celebration.
Like an awareness month.
Yes, so we plan to collaborate with the River State University Teaching Hospital as well as with the Nigerian Cancer Society, since they had the umbrella cancer NGO in the country. We're expecting their national officials to be in River State close to the end of February. So we plan to have a mega rally with them, all the NGOs, together with the State Ministry of Health, and also open up the hospitals for free screening. That
Dr. Okoro,
particular-
yes.
Yes, so I've already made her acquaintance, so I will be speaking to her more on this. So we plan to indicate at the hospital to everyone for free screening for that particular day. We hope to offer free mammograms, free cervical cancer screening
For a day?
with VIA. Yes, we will bring in the capacity.
One day.
Well, oh, okay, well.
You know, so you see, the thing is, we have discrepancies in when people access information that we push out.
Okay.
So when you push out the information, a lot of people may not get the information if it's one day.
Okay.
But if it's over several days, then they're likely to meet up at least one day. And because this facility will require a significant amount of word of mouth to send out the information, I think we'll be doing ourselves a disservice if the free screening is for one day. So, you know, sit with our NCD coordinator at the ministry, with your team, put together something that's workable for you, but there will be sacrifices that will have to be made in this initial period as you're trying to create that demand.
Absolutely, Honorable Commissioner. So
You know what I'm saying, because I
understand.
know they'll be looking at you because
We understand. We understand. No, we will. We will extend
so
it.
yes.
Okay, we will extend it. We will. And it's a good idea that we do that, just as you had.
Absolutely. And there are two more points that we just wanted to discuss quickly. I think one is as we get clinically, there's a certain stage that we want to reach over the next 2 months, where we start the outreach to all the different corporates in the region, because it's important that we get their support and their buy-in. It's an important thing for us to do, and because we'll get to that, important why it is important, but we will of course collaborate, with the state at that point for us to, enable that
path.
that path. In terms of congregating them and pushing them towards one common purpose. And I think the last point is really on the positioning of the hospital, because of course this is a state hospital, it's a public hospital with very high-end world-class infrastructure that can accommodate of course for the general demand, and can also accommodate for corporate and different types of services. And so this, our plan is to services
Different segments.
different segments.
To cover all the community.
Pricing, of course.
Those who will have the capacity, they will pay more
There'll
to
be a
cover,
premium.
to cover the low price that we will put to the majority sector. It will be like this.
Of course, the quality of care
It's
is
the
exactly
same, but customized service for those who are seeking for it.
So have you thought through how government can support that process of getting at least populations who are not within the demographics that can afford the full gamut of services that you have?
It will be executive package, through executive packages,
Okay.
through corporate, through marketing. It will be like this, giving this offer to, especially in screening, because executive people need to screen for cardiac,
Yeah.
for cancer.
And
It's essential.
their screening is annual.
Yes.
Yes, and also this is for the corporate, of course. For the government can also potentially over time support with access for the indigenous population.
Yes, that's what I was going.
Absolutely, in terms of subsidizing certain services. I think this is something that we will support.
To have key contacts.
Like to discuss with you, and for you to consider as we build up those clinical services.
Sounds good to me. So we'll follow up those conversations by the time you have like your pricing packages, and then we see what we can do from the government perspective to support those who are in need of those services, but obviously are unable to afford. Because yes, we have state health insurance, but it's limited in terms of the scope that it can cover.
Very good. Very good. And yeah, so hopefully we can you can visit us again soon.
I will be visiting you regularly. I will be visiting
Scheduled
you
and
regularly.
unscheduled.
Yes.
Yeah, the unscheduled one will play a very big role. The unscheduled one.
So
Especially-
let me just congratulate the team at
Thank you.
Posh, management and the staff for taking the bull by the horns and basically seeing how to kickstart this facility. Like you rightly said, it signifies a massive investment from the state, and I do believe that over the years, for various technical and operational reasons, the facility wasn't open for the benefit of the people. But I think we are at a critical juncture where thankfully the doors are now open. You have full confidence that facility readiness is close to 100%, and in coming weeks and coming months we'll have the full gamut of services that we foresee, so that this facility is rightfully placed as a center of excellence for oncology services, cardiovascular and nephrology services as well, and will significantly boost the capacity of health personnel in these various areas, and of course undergraduate medical training and nursing training. So thank you very much. Well done.
Thank you.
Thank you. Thank you.
Thank you.
We
and
are
thank you for
honored.
your invaluable support. Support of the